Well, it's actually been a pretty good boom for us because with standard culture and sensitivity, we can determine what bacteria is involved, and we can determine generally which antibiotics we can use.
Mhm.
And of course, there's bacteria that's wound colonizers, but
Right.
there's also bacteria that's an infecting agent.
Sure.
Although the infection is much more severe, the wound colonizers can certainly slow down formation of what we call the granulation base,
Hmm.
which is, of course, the where we can then overlay a skin graft or get healing of the native skin.
Right.
With the PCR testing, not only can we identify the bacteria and generally which antibiotics will help to kill that bacteria, but we can then contour those antibiotics directly into a combination of topical antibiotics and, if we prefer, in tandem, oral antibiotics.
Okay.
And for us, it has been nothing short of fantastic working with Ability Lab and their collaboration with the pharmacy that we use.
Okay.
Any difficult wound, we just automatically now have shifted over to PCR.
Okay.
In other words, if we get a standard patient who comes in with a simple diabetic wound,
Hmm.
and the debridement, local wound care, and the oral antibiotics are doing the trick,
Right.
then we're fine as long as we're making progress.
Right.
And as we all know, sometimes the wounds will make progress. Sometimes they stall for a few weeks and then
Hmm.
they come back and start to heal. But anything that looks like it's giving us a little bit of difficulty, anything that seems like it's taking its time, that it's dragging out,
Hmm.
the PCR has been very helpful for us.
That makes.
Very helpful. It gives me another avenue, another angle to look at to see what may or may not be causing the stalling effect
Sure. That makes
of
sense.
the wound, assuming the circulation is adequate,
Right.
and of course the glycemic control is accurate.
Okay.
Right. What we want to do again is we want to target the infecting organism, because with the oral antibiotics or with IV antibiotics, we might wipe out some of the specific bacteria that may compete with the affecting organism that could actually slow it down.
Sure.
And so by using a detailed laser focused topical antibiotic, you might call it,
Right.
we're killing the infecting organism, but again, we're not damaging us
Yeah.
as time goes by. Well, most of mine, of course, is anecdotal. Although we have discussed working on a study where we can actually do something double blind. In this particular circumstance, I have seen accelerated healing rates. For example, I had one lady recently who ruptured her Achilles tendon, but it ruptured out of the skin.
Okay.
And so what then happened was she ended up with a gaping wound. Even though we were able to repair the Achilles tendon, that wouldn't heal.
Right.
So fortunately for us, she had very good blood supply, but of course, the Achilles tendon does not have good blood supply. The utilization of the topical antibiotics, we were able to reduce or eliminate those bacteria on that Achilles tendon graft, whereas if we used simple oral antibiotics, it never would have penetrated.
Right.
So from a practical perspective, we're seeing what I would call a significant reduction in healing time. Topical medications over the past several years have gotten a bad rap for being terribly expensive, thousands of dollars.
Hmm.
And I can tell you that I don't think my patients have paid more than $40 or $50 for a copay on the topical antibiotics, even the ones that are custom fabricated.
Okay.
So again, I don't want the audience to get confused with those $3,000 topical prescriptions. We are not talking about that whatsoever. So my simplistic approach here in the clinic is that, again, I will, depending on the depth of the wound, uh, I'll usually try to do a culture before I do any debridement. However, sometimes after my debridement, if I found an abscess or if I found some type of a sinus tract, then I'll simply dispose of the first culture and I'll culture deeply. It doesn't cause any pain to the patient. Basically, it's a swab. However, once the swab is treated properly, we can get a wealth of information from that. Well, I am a very practical person, and I do know quite a few podiatrists, and I know that the slow healing wounds are not only uh, uh, negative, create negative feelings for the patients, but they do for the doctor also.
Sure.
My advice would be give it a try. I think you'll be happy with it. There's no downside to it. If you can increase your patient healing rates, you will then not only have a happy patient, but you have less stress in your practice, and you won't lose that patient to another doctor with the patient saying, well, this podiatrist or this physician didn't do anything to help me. There's no clinical change, no protocol change in your office. You would take a standard culture anyway. This is just as easy as taking a standard culture. There's really no downside to giving it a try. There's only an upside. That would be my advice. Personally, and again, there may be physicians who disagree with this. I'll take a shotgun approach, and I'll try to get whichever ones are. For example, when we use the lab, we'll get a printout of the different bacteria and the different antibiotics, just like you would on a typical culture, but there's much more detail involved there. So what I'll try to do, if there's 4 or 5 bacteria, I will try to find the one oral antibiotic to get the patient started on, at least initially, until we get the topicals that will kill 4 out of the 5. Okay. And just to kind of hold things at bay until we get the topicals started. Of course, there's always, one organism, a Staph aureus, an MRSA, that you really want to get out of that infection if at all possible. But that's I hate to say the outlier, but if there's not that type of a problem going on there, then I really take that shotgun approach, trying to get whatever appears to be a pathogen. Right, and that's, again, a personal approach, but the one thing that concerns me is when I see the clear sheen on a wound, and there's no foul odor. There's nothing that sets off my alarm bells, but there's also nothing I can put my finger on. The erythema around the wound, the depth of the wound. But when I see that kind of clear sheen, that makes me think Pseudomonas or something that's not a purulence producer, that's one of my key go-tos. Would be the PCR testing, where I'm just not sure what may be in there. If I open up an abscess and there's a lot of purulent drainage, my assumption goes to staph, and I use an anti-staphylococcal. If it doesn't get better, then we would do the PCR testing. But it's those wounds that just don't present clinically as a textbook picture that I need additional help with.
Gotcha. Okay, that makes sense. Again.
Also, if I can add, sorry to interrupt.
Sure can, please do.
I think anytime a culture insensitivity is thought about to do, I think your PCR is just going to give you a better idea. Anytime a clinician says, we probably should culture that, it should be, let's get a PCR test, because you're going to know exactly what's in there.
Right. Now,
and then we had a picture of a leg wound that I had sent that Dr. Adams was kind of discussing. I think you can kind of see what's going on when he was talking about the sheen on this. I know a lot of times we say we don't see biofilm, but in this type of a wound, I think it's pretty prevalent. That's one of the things that's going on. And it was actually, I had taken this picture and that's exactly what was happening. But this is kind of a visual to give just to show sometimes what that might look like.
Well, thank you, Therese. I appreciate that. For the clinicians, for the physicians, it's kind of a no-brainer. The report is right in front of you. I go over my reports at lunch, and then I go over the new reports that come in at the end of the day. And you don't have to ponder and ruminate and think about what you want to do. Within reason, of course. There's always those complicated cases, but they'll list, the growth ostensibly as mild, moderate, or severe, heavy growth, light growth, and then we take it from there. The assistance that they provide makes my life much easier.